नमस्कार, मेरा नाम हेमंत है। मैं दिल्ली में रहता हूँ। मेरे 2 महीने पहले मेरे चेस्ट में बहुत दर्द हुआ था, जिसके कारण मैंने वहाँ पे दिखवाया था। और फिर मेरे जो वहाँ पे एंजियोग्राफी करने के बाद स्टेंट डाले उन्होंने। उसके बाद मेरा जो है फिर दर्द हुआ। फिर मैंने डॉक्टर साहब से कंसल्ट करा और यहाँ का मैंने यूट्यूब पे, फेसबुक पे देखा कि यहाँ का एक हॉस्पिटल है, केयर हॉस्पिटल, उसमें प्रतीक भटनागर जी हैं। उनसे मैंने संपर्क करा और मैं अब आया हूँ और मेरी बाईपास हुई है और मेरा ऑपरेशन हो गया है। बाईपास सर्जरी मेरी बहुत सक्सेसफुल रही है और कोई मेरी जो वो हुई है, बीमा टाइप हुई है। कोई मेरे पैर वैर में कोई कट नहीं हुआ। मेरी रिकवरी हो गई है, मेरा ऑपरेशन हो गया है 7 डेज़ में। मैं आज डिस्चार्ज हो रहा हूँ और सबसे बड़ा धन्यवाद मैं डॉक्टर साहब को बोलना चाहूँगा, प्रतीक भटनागर जी को। मेरी ओर से उनको बहुत बहुत धन्यवाद।
Hello, I am Dr. Pratik Bhatnagar. I am Director of Cardiac Surgery at Care Hospital, Banjara Hills in Hyderabad. Today I am going to talk about a very interesting young gentleman, Mr. Hemant. Mr. Hemant is a resident of Delhi NCR and he was having chest pain, that is angina, for some time. So he consulted his doctors in Delhi and after angiography it was found that he was having blocks in the coronary arteries of his heart. And the blocks were located at the most important part of the coronary arteries, what is called the left main coronary artery. So after the blocks were detected, he was given stents in the left main coronary artery of the heart and the adjoining parts of the coronary arteries, that is LAD and left circumflex. So he was discharged, he went back after the stenting, but the problem with left main stenting is that if the stent blocks, that can be a life threatening situation. Unfortunately, in his case, just after 2 or 3 months, he started getting angina once again. Now this became a critical situation because it looked as if there was some problem in the stents placed in the left main coronary artery. Mr. Hemant, according to he himself, started doing his search where to go for further treatment so that he could get a good long-term benefit. And according to the family, after a good search, they decided to get treated under me at Care Hospital, Banjara Hills in Hyderabad. So the patient and the family took a flight and came over to Hyderabad, and we admitted him. And a coronary angiography which was done by a colleague of mine at Care Hospital showed that the stents that were placed in the left main coronary artery of the heart had caused a tight left main stenosis, and the stents had then blocked at the places where the LAD and the left circumflex coronary arteries were placed. So this was a very critical situation, and if not treated on time, it can lead to a fatality. So we immediately took him up for a bypass surgery, and we gave him 4 bypass grafts, all arterial, on the beating heart. So without open heart surgery, we did the entire bypass surgery and without making any cuts in the legs. This operation that he has got, which is called total arterial revascularization, gives a best long-term benefit to the patient. When we use bilateral internal memory arteries, that is BIMA, from inside the chest, they have a long life, and there is no cuts on the legs also. So the patient gets a dual benefit of long-term survival as well as no cuts and no pains here and there. So less trauma, less invasive procedure and less pain. Simultaneously, it is cosmetically better also. So in nutshell, what I would like to say, and now this patient has recovered nicely and he'll soon be flying back to Delhi with very, very happy memories of Hyderabad, of my team, and of the hospital. So my message to everyone is, do not be afraid of coronary bypass surgery. A standard bypass surgery with BIMA in our hands has a risk of less than 1%. That is one message. Second message is, stenting on the left main coronary arteries can have its risks and repercussions. So patients should go happily and confidently with the bypass surgery like Mr. Hemant did. Have a good day, everyone.